Well, thanks to research at the University of Minnesota Fairview, people with heart problems can have a better quality of life. And today at the Minnesota State Fair, you can learn about the left ventricular assist device, or LVAD. That's a pump that makes weakened hearts strong again. Joining us to explain exactly how it works is Cindy Martin. She's an assistant professor of medicine at the U of M. Cindy, thanks so much for stopping by today.
No problem. It's great to be here.
So, first of all, before we kind of get into this actual device, you've got an event today at the fair. Kind of gives people an opportunity, it kind of demystifies what it is that's going on here.
Exactly, and we call it LVAD Day at the fair. It's our second annual event. Last year we had 25 patients with LVADs who are actually out at the fair. And what we do is we give the opportunity for the public to see the device and see people with it. Also some education about heart failure. We also have anatomic specimens from the Anatomic Society from the University of Minnesota there, so we can show people what a normal heart is and what an unhealthy heart looks like, and just some tips on, healthy eating and good nutrition and try to maintain your heart health.
So a lot of people, heart failure is a affliction that affects a lot of people, and this device is basically an idea to help kind of keep them going no matter what the next step in their diagnosis might be.
Absolutely. As you said, I mean, there's hundreds of thousands of patients in the United States that have heart failure, and unfortunately when it comes to end-stage heart failure, their quality of life is really limited. They're very short of breath and can't really do anything, and a lot of times our medications just don't do the trick. And so that's what the LVAD, or the left ventricular assist device, really helps us out with. This pump is actually implanted into the patients and can really takes over the pumping work of the heart, and it allows us to restore that quality of life for the patients.
And then they wear basically a device kind of goes in a bag that they wrap around their waist, and then they can have this thing on for, you said, almost 10 years?
Right. The pump itself is estimated that the lifespan will be 10 years. The longest implanted right now we have is 8, but we're anticipating that we'll make that time. And if there is problems with the pump, there is an opportunity to actually replace the pump itself for surgery. So this really is a sustainable device for these patients to really give them a great quality of life.
Now we're almost out of time, but how long has this particular device been being used in patients?
So we've been doing, so from the research studies and stuff, it's been going on a little bit over about 10 years now. We at the university have a patient that's been implanted for 7 years.
So it's pretty incredible, and I mentioned we have firsthand knowledge of this. In my family, lost my father, heart failure, just a couple months ago. So I mean, I can tell you folks, if there's anything out there that can help keep everybody around for a while longer, I mean, this is just a really great deal.
Right, and it's not just keeping them around, it's keeping them active and healthy and enjoying that life.
And feeling good.
Exactly.
Because that's so hard for them.
Absolutely.
All right, well, Cindy, thanks so much for stopping by. And if you'd like some more information about this, you can learn more, see one of these devices for yourself. The event at the fair today runs from 9 to 3 o'clock at the University of Minnesota building, also known as the Crossroads. That's located on the corner of Underwood Street and Dan Patch Avenue.